We did our project on shaken baby syndrome, the disease and its symptoms. Pathophysiology. Shaken baby syndrome is a traumatic brain injury that occurs when an infant or child is shaken too vigorously. The infant/child's brain hits the frontal lobe and occipital lobes of the brain violently, causing swelling of the brain and damage to blood vessels. Since the brain is enclosed, if the brain swells, there is no escape, causing the brain to not function properly and possible brain damage. Signs and symptoms: convulsions, seizures, decreased alertness, extreme irritability or other changes in behavior, lethargy, sleepiness, not smiling, loss of consciousness, loss of vision, no breathing, pale or bluish skin, poor feeding, lack of appetite, and vomiting. This is an educational video of shaken baby syndrome and the effects it has on the child's brain.
For risk factors, we have domestic violence, unstable family situations, a history of child abuse, alcohol or substance use, young parents or parents with no support at all, depression or psychiatric illnesses, newborn with special health needs, and under the age of 2 years old. Therapeutic procedures includes respiratory support. In severe cases, treatment may include life-saving measures such as HCP. They may insert a breathing tube down the child's throat. Second would be medication administration to amantadine and propranolol, which may help with cognitive deficits, and anticonvulsants like benzodiazepines to prevent seizures. And lastly, we have surgical care. A surgeon may have to perform surgery to stop the bleeding or to reduce the swelling inside the baby's brain. Procedure is called craniectomy. We have complications of this illness. One it would be seizures, which is often considered a common feature of this condition, and their presence is associated with a poor prognosis for the affected child. This may indicate more severe brain damage, injury, and potential for long-term complications, such as cerebral palsy, which is a type of foot abusive head trauma that can cause irreversible brain damage. And lastly, we have hearing loss. Affected children may have permanent deafness.
Some lab and diagnostic testing that can be done to prove if a baby has shaken baby syndrome is an eye exam that identifies retinal hemorrhage and it's a hallmark sign of shaken baby syndrome, a CT scan, which detects acute brain injuries such as subdural hematomas and intracranial bleeding, an MRI, which gives detailed images of the brain tissue for better visualization of brain damage and potential areas of decreased oxygen supply. There's also an X-ray that can be done, which examines the entire skeleton for potential fractures. Some labs that can be done is a CBC, which checks for signs of anemia or other infections, coagulation studies to assess bleeding and rule out other bleeding disorders, and a metabolic panel to rule out other causes of symptoms like metabolic disorders.
Medications. While there are no medications that directly treat the underlying cause of the shaking, medications are used to bring the client relief and manage the secondary effects of the trauma. Each case of SBS is different, and there is no single medication for SBS itself. This includes pain management, so acetaminophen or ibuprofen can be used for mild to moderate pain control. Opioids may also be used in cases of severe pain, particularly in a hospital setting or following surgery. Anticonvulsants such as Keppra are used to control seizures, which are a common complication of brain injury from SBS. Sedatives such as Versed and Ativan may be used to manage agitation or anxiety. particularly if the child is in critical care or recovering from trauma, and osmotic diuretics are used for elevated intracranial pressure. So medications such as mannitol or hypertonic saline reduce brain swelling by drawing fluid out of the brain and reducing ICP, which is a serious concern in cases of severe brain injury. So care plans are based on severity of the client's case. So the real life impact of this condition is that a mother's mental health is so important, and mothers may experience shock, trauma, blame, guilt, depression, and psychological distress.
Thank you.